Happy Monday, everyone. Let's continue the series of breast cancer. So today, first I want to talk about different differential diagnoses when there is a mass in breast. So some of this mass is really benign, so we need to know about different types of them. One of these types will be just a simple cyst in the breast. So it usually happens in women in the age range of 30 to 50 years old. It's a round mass which is fluid-filled and movable, which is totally benign. Also, breast mass can be fibroadenoma, which is a firm mass but it's non-tender with distinct border and it's mobile, and it's usually seen anytime between menarche, 15 years old, and menopause. There is another condition which we called it fibrocystic breast disease, which usually present as a thickened, lumpy area in the breast, which is usually firm and painful, but is still mobile. And is interestingly, the size of this lump in breast usually fluctuate based on the day of your menstrual cycle. So it's really hormonal related and benign. Sometimes the mass in your breast might be just a lipoma. It's usually seen in postmenopausal women. It's a soft and movable mass which is non-tender with distinct border. Breast mass might be fat necrosis, which is usually happen after any kind of trauma to the breast. So after trauma, you might notice a firm, round, but painless mass in the breast. But because of the scar tissue, it's usually kind of a skin retraction over the skin of the breast. Also, mass in the breast might be a breast abscess, which is usually happen after mastitis, which is the inflammation and infection of the breast. Sometimes it happened in women that they do breastfeeding, but also it might happen in other conditions. It usually come up with a mass which is very red, hot in the area. It's very painful and firm. And it's important we know that also besides this mass, there is a enlargement of lymph node in the area, especially in the axillary area as well. Because there is one type of breast cancer which is called inflammatory carcinoma, and it's very similar in terms of picture with breast abscess, we should be careful when we encounter this kind of condition in terms of doing more investigation. Now, what about breast cancer? So as I told you, one type will be inflammatory carcinoma, which has a very similar picture as a breast abscess, but the two major one is invasive ductal carcinoma, which is the most common breast cancer, and invasive lobular carcinoma. 10% of breast cancer is usually this type, and is usually present as a bilateral breast carcinoma. So after we come up with a breast mass which more suspicious toward breast cancer, in order to have a good plan for managing breast cancer, we need to do grading and staging to know more about the tumor. So grading, which is usually happens in 3 different grades, it's done based on the cell differentiation. Less cell differentiation in the tumor is more aggressive tumor. Staging is usually done based on a system which is called TNM. So they consider size of tumor, the involvement of the lymph node, and metastasis to any other organs. It's come up with 4 different stages. Stage 1 is a tumor which is smaller than 2 centimeters with no lymph node involvement and no metastasis. That is come up with a stage 4, which is any size of tumor but with lymph node involvement and also metastasis to the other organs. Other important things that we should know about breast cancer is the hormone receptor status. So 60 to 70% of breast cancers are estrogen or progesterone or both estrogen progesterone receptor positive. These kind of breast cancer are usually less aggressive and they respond very well to endocrine therapy. They usually spread to skin, lymph nodes, and bone. There is also another type of receptor which is called HER2. 20% of breast cancer express HER2 receptors, and in this case, usually cancer is more aggressive and spreads to lung, liver, and brain. Sometimes we heard about one type of breast cancer as triple negative. Triple negative breast cancer means that there is no expression of estrogen, progesterone, or HER2 receptors. This type of cancer usually has the worst prognosis. It's usually seen in younger women, in those that they have BRCA gene mutation, or in Black women. In the next video, I will talk about the prognosis of breast cancer and a little bit about conventional treatment.